Hello, and welcome to New Mexico Rising. My name is Mandy, and here on this show, every week we interview some awesome people from around the country to bring you lifestyle tips, tricks, and more. And this week we have this.
Another 98 million individuals in the United States have prediabetes.
Carter Work Project is Habitat for Humanity's signature event every year.
All that and more on New Mexico Rising.
If someone near you suddenly collapsed, would you know what to do? The American Heart Association just released its 2025 CPR guidelines that are designed to help more people act fast and confidently in an emergency. So joining us is Dr. Ashish Panchal from Ohio State University Wexner Medical Center to share what's new and why every second matters. Welcome to the show, Doctor. How are you?
I'm great. Thank you so much for having me.
Okay, so what are some of the key updates in the 2025 CPR and emergency care guidelines?
Well, in the American Heart Association guidelines, as a volunteer, we focused on bringing the newest science to everyone. That's lay rescuers and healthcare professionals. These updated life-saving recommendations really focus on cardiac arrest, choking, opioid overdose. We're making it easier for everyone to remember and use. When we think about cardiac arrest, what do we do if somebody suddenly collapses? We do hands-only CPR. We push hard and fast in the middle of their chest after calling 911. What about choking? This is the big change. With choking, what we're doing now is we're doing 5 back blows followed by 5 abdominal thrusts for adults and children. For infants, we have a caveat here. We're doing 5 back blows followed by 5 chest thrusts with the heel of your hand because we want to keep their vulnerable bellies safe. So that gets you started. The other area we think about is the opioid overdose area and really responding to these overdoses. And the best way to do that is have Narcan or naloxone available to you so you can help somebody out.
And the new chain of survival is now unified across adults and children. How does that help bystanders respond a little more effectively?
That's a great question. The consolidated chain of survival really makes it so that we are all working off the same sheet of music. It simplifies our understanding of life-saving steps, and it emphasizes a lay rescuer's role. And that's the key concept so that we can act quickly and easily. The first 3 chains are all about the lay rescuer. The first one, recognition and emergency response. Call 911. Then the second chain, high quality CPR. Now we need to push hard and fast in the center of the chest. The third, defibrillation. Get an AED so that if somebody needs a shock, they can get shocked. And after that, our EMS clinicians will be there to help. Those first 3 steps are the same across the board and are perfect for the best way we can save someone's life.
So what are some simple steps that parents, caregivers, and everyday people can take to try to save a life?
Yeah, the first step is to get trained. So as I said a second ago, remember for cardiac arrest, we need to do hands-only CPR. That's going to be us calling 911, pushing hard and fast. For choking, don't forget about the 5 back blows and the 5 abdominal thrusts. That's the big update because the data has shown us that the 5 back blows work the best. And last but not least, go out and get yourself some Narcan or naloxone. So if there is a suspected overdose, you have it available and so you can use it. Remember, recognize the emergency and be ready to help. And that's how we save lives in our community.
So where can people go for more information about these new guidelines and let's get trained?
Yeah, you can learn more at heart.org/nation. That's heart.org/nation and become part of the nation of lifesavers. Now, one thing to keep in mind, so many of these events happen in the home. These are your moms, your dads, your aunts, your uncles. Prepare yourself. It's the holidays coming up. Learn yourself, talk to them about it so that you can save a life and that life could be one of your loved ones.
Doctor, I want to thank you for joining me today.
It is my pleasure. Thank you so much.
Caring for a loved one can be the most meaningful and the most exhausting job you will ever take on. There are more than 63 million Americans that are doing it right now. And today, we're spotlighting National Family Caregivers Month and a new way to plug into care with real resources, community, and practical help. So joining me today is Marvell Adams Jr. from Caregiver Action Network and nurse educator Michele Mongillo from Prevail. Welcome to the show, you two. How are you?
Thanks so much for having us. Doing great.
Good, thank you.
Okay, so Caregivers Month shines a light on what so many families are facing. What resources and supports are out there to basically help caregivers feel less overwhelmed and maybe a little more confident?
So, Caregiver Action Network has been leading National Family Caregivers Month for nearly 30 years. And this November, our Plug into Care campaign is really by providing easily accessible, vetted information that provides caregivers with not only simplified access to resources, but also giving them the opportunity to go from being overwhelmed to being informed and confident, whether they're supporting a loved one that's navigating incontinence care, someone that is living with Alzheimer's or dementia, or perhaps challenging cancer. They can find information easily and at their fingertips at nfcmonth.org.
And Michele, you wrote a new book on incontinence care called Caring with Dignity. That's really a tough topic for a lot of families. Why did you write it, and what guidance does it offer some of the caregivers out there?
It is a very tough subject, and I wrote Caring with Dignity to provide a much-needed resource for caregivers who are taking care of someone that might have incontinence. And in this book, there's topics that range from nutrition management to dementia strategies to finding the right incontinence product, which can be confusing, as well as even maybe traveling with incontinence. And I think equally important in the book is how to start that delicate conversation with the person that you're providing care to, which can be really tough.
And from your perspective as a registered nurse and educator, how do we remove the stigma around incontinence and empower the caregivers nationwide?
Yeah, and incontinence has historically been a very taboo subject. It's embarrassing. People don't want to talk about it, and it can be life-changing. And as a clinical educator, it's important to bring the subject of incontinence to the forefront and open up the conversation about a very common condition that affects millions of people every day. And Caring with Dignity as a resource and partnering with organizations like Caregiver Action Network can really be a path towards destigmatizing incontinence.
And Marvell, caregivers don't often know where to start. How does the Plug into Care campaign make it easier to find help and some of that real-world support?
So there is a lot of information out there to support caregivers and educate them. So at nfcmonth.org, they can find easy, reliable information that is from a whole host of not-for-profits, over 80 not-for-profits providing content and information specifically for caregivers and their caregiving journey. And so the Plug into Care campaign is all about providing information, whether it's a tap, click, or conversation away, through downloading our app, through visiting our website, and making it really accessible for caregivers to find the information they need, no matter what the challenge they may be dealing with.
And for anybody that is watching that might need this right now, where can they go for more information and get some of these resources?
So they can find us at nfcmonth.org, or they can reach out to our National Family Caregiver Help Desk, whether that be through a phone call, downloading our app, or even through the web.
Hey, I want to thank you, too, for joining me today.
Thanks so much for having us.
Thank you for having us.
Even the strongest, most active people can get sidelined by RSV. It's a virus that can be serious for adults 50 and older. Dr. Leonard Friedland from GSK and National Senior Games athlete Carol join us to share what happened to Carol and how she's helping others learn from her experience. Welcome you both. Thanks for being here.
Thank you.
Thank you.
Carol, would you tell us about your experience with RSV and how it changed your perspective on health?
Certainly. Well, first of all, I thought RSV was something that could only happen to infants until I contracted it at 55. My experience led me to be ill. I was unable to breathe, in bed, aches, pains, lack of energy. I was down for about 8 weeks, or just about 2 months. So I was unable to train, unable to spend time with my family, and it affected all of the things that had to do with my life, with my training. I joined this campaign because I wanted to be able to share my story about what happened with me, and I want to make sure that others are informed, or at least understand that there are options, that there are things that they can do to help prevent contracting something like, or at least being affected severely by a virus such as RSV.
In which ways did this illness change how you look at staying well, especially since you've always kept such an active lifestyle?
That's such a great question. It made me look at my health holistically. I think at the time, and what I'd been doing up to that point, is I had been looking at what my body could produce, looking at outcomes, what I could physically make my body do. And it was working. Once I developed RSV, or severe RSV, I couldn't do any of that. And so it reminded me that I need to look at my whole body, not just what it's doing, but what I can do to get the most out of it and stay healthy. So it made me look more at preventative care for my health and not just my muscles and my physical performances.
And Dr. Friedland, can you explain why RSV is especially concerning for older adults or those with certain conditions?
Absolutely, Abby. So RSV, or the respiratory syncytial virus, it's common and it's contagious, and it can infect our lungs and our breathing passages. And while it can start what looks like a common cold, it can be really difficult to distinguish between a common cold or flu or COVID. But this disease can be very debilitating. It can result in people struggling for air. If you're struggling for air, you're not able to drink or eat properly, you can get dehydrated. And about 177,000 adults each year in the United States over 65 need to be hospitalized for RSV. There is no treatment for this. There's no medication to treat it or to cure it. It's all supportive care, oxygen, rehydration. And unfortunately, a good proportion of those adults who are hospitalized are so sick they end up in the intensive care unit. And about 14,000 adults over age 65 will die from RSV each year in the United States. So it can be quite severe. And Carol's story is really quite typical of the way this disease impacts adults. Because adults are at risk for RSV, it's advancing age that is a particular risk factor, particularly for people 75 and older. And for people 50 to 74, people can get severely sick who have underlying risk factors such as COPD, asthma, like Carol has. Diabetes, heart disease, and weakened immune systems all put people at increased risk.
And for those 50 and older, why should they think about taking preventative steps before RSV season starts?
That's because for people 50 to 74 who have underlying risk factors such as COPD, asthma, diabetes, heart disease, weakened immune systems, they can end up in the hospital with RSV and get really quite sick. And for people 75 and older, just in general, the increasing age is a risk factor as well. And so the reason to think about this is because there is no treatment. The best tool we have is prevention, and that tool is vaccination. And so the CDC now recommends that all adults 75 and older receive a single dose of an RSV vaccine. And for people 50 to 74 with those underlying risk factors, COPD, asthma, heart disease, diabetes, weakened immune systems, they also receive a single dose of an RSV vaccine, because that is the tool that we have to help protect ourselves against getting severe outcomes from RSV.
And what simple things can help lower the risk of severe RSV?
Well, the simple things would be hand washing, staying away from people who are sick, good diet, exercise, general overall health. But there is no treatment. And so the best tool we have is prevention. So resources, sidelinersv.com is a website to provide resources about RSV. There's a discussion guide there that can be used in discussions with your doctor or your pharmacist. Now's the time to have those discussions because this virus circulates in the fall and in the winter. But we think that patient stories are critically important, and that's why we've teamed up with Carol and other senior athletes to talk about how this disease has sidelined them from the work that they do every day, the things that keep them healthy, give them joy in life. And there's a TV special where Carol is featured called Redefining Aging with Senior Athletes. That TV special can be found on GSK's YouTube page, but also sidelinersv.com can direct you towards resources, following on Facebook and Instagram to find out more about RSV, find those patient stories, and then have that discussion with your provider about vaccination as a tool for you or to help you protect yourself against disease, especially if you're 75 or older or 50 to 74 with those underlying risk factors.
One more time, where can viewers go to see the Redefining Aging with Seniors Athletes program?
The best place right now is GSK's YouTube page, Redefining Aging with Senior Athletes. You can find that on GSK's YouTube page. And for general resources, sidelinersv.com. You can find patient stories there. And again, that discussion guide to use with your doctor or your pharmacist.
Dr. Friedland and Carol, thank you so much for joining us today.
Thank you for having us, Abby.
Thank you, Abby.
The 39th Annual Habitat for Humanity Jimmy and Rosalind Carter Work Project is happening this week in Austin, Texas. It's the first since President Carter's passing. More than 1,000 volunteers are working side by side to build safe, affordable homes and carry on a legacy that's changed lives around the world. Joining us are Jonathan Reckford, CEO of Habitat for Humanity International, and Michele Anderson, CEO of Austin Habitat for Humanity. They're here to talk about the incredible project and what it means to families in need. Welcome, you two.
Thank you. Great to be with you.
Jonathan, can you tell us a little about the Carter Work Project and the communities Habitat is helping each year?
Well, we are thrilled to be coming to you from Austin, Texas, where behind us you can hear the music of 1,000 hammers and see homes rising up. The Carter Work Project is Habitat for Humanity's signature event every year to bring attention to the huge need for safe and affordable housing. And most people think President Carter started and ran Habitat. That's not actually true. But what is true is when President and Mrs. Carter famously rode that bus up from South Georgia to New York City, slept in a church, and helped rehab an apartment building on the Lower East Side of Manhattan. That's when the world found out about Habitat. And that started decades of their building all over the world and inspiring millions of people to get involved in our mission. And we know that it's so sad not to be having the Carters out here with us, but we know that the best way to keep their legacy going and what they would want is to keep the work going.
And Michele, Austin's housing market has been tough for so many families. Can you share some of the changes homeowners are facing right now?
Right. So being one of the fastest growing cities for 10 years has really widened the gap. So hardworking Austin families in Central Texas can no longer afford to buy a home in Austin. So they're faced with a tough choice. Do they want to stay in Austin? Do they want to rent? And that's where we step in. So we are increasing the number of affordable homes for home sales so our families can have stability. Their children can go to the neighborhood school. The family can get involved in the community. We see health of people and home ownership goes up. Education attainment goes up, and it's also the biggest way Americans build generational wealth. So we really put our families on a wonderful trajectory. And so that's what we're doing. We're scaling, we're building more homes, and we're launching that with the Carter Work Project this week, building 25 homes right behind us here.
And Michele, what makes this year's Build in Austin stand out from past projects?
Sure. Well, first, it's the first time we'll be putting 91 homes in the market in 1 year. Second, these homes are in a master plan community, our first, and they're also extremely efficient. So the homes have solar roofs and they have all kinds of green material and cost-saving measures. So we're expecting our homeowners to have extremely reduced electric bills. So it will continue the savings that they will have on a home and stability, and again, be able to pass this along to the next generation.
And Jonathan, Habitat has always worked closely with volunteers and partners. Why are those relationships so important for the mission?
Well, to solve something as important as housing, it takes everyone getting involved. We need the public sector, we need the private sector, and we need the social sector, civil society, all working together. And we couldn't do our work without our donors, our volunteers, our corporate partners. They bring funds, they bring materials, they bring skills, they bring muscles, and they bring their voices to help change attitudes and help create communities and a world where everyone has a decent place to live.
And for anyone watching and they want to help, where can they go for more information or to get involved?
If you go to habitat.org, you can learn how to get involved in your local community. We work in Albuquerque. We work in almost 1,000 communities across the U.S. and all across the world. And the not-so-secret thing President Carter always said is he always felt he got more out of his volunteer work than anything he was able to give. So come be a part of Habitat. It will change you, and you can help change the world.
Wonderful work. Thank you so much for joining us today, Jonathan and Michele.
Great to be with you. Thank you.
Online gaming has become part of everyday life for families. It can be creative, social, and fun, but it could also come with challenges that can make parents a little more nervous. From chatting with strangers to spending too much time online, keeping kids safe while they play is more important than ever. So joining us this morning is Dr. Elizabeth Milovidov, Global Head of Parental Advocacy at Roblox, and a mom of two tech-savvy teens herself. She's here to share what Roblox is doing to help parents feel more empowered and how families can build healthier digital habits together. Welcome to the show, Dr. Milovidov. How are you?
Oh, I'm great. Thank you so much for having me.
Okay, so you're the first ever global head of parental advocacy for Roblox. That's a huge role. What does that title mean and what inspired you to take it on?
Yeah, well, actually, I think I'm the first head of parental advocacy anywhere because really I've never heard of this before and it's newly created. What inspired me to take it on is that just I've been doing digital parenting for over 15 years. I'm a lawyer, law professor, was consulting in Europe and now in North America. And it's just so exciting to be able to support families, and that Roblox really tapped me on the shoulder saying, okay, it's go time. We really would love to have some help. We would love you to be the voice of parents and caregivers for us within Roblox. And we would love it if you were a bridge to help bring in some of those parental concerns into our stakeholder meetings, because we really would like to have a core partnership with parents. So here I am.
And you recently announced the Roblox Parent Council. How will this help parents have a stronger voice in shaping the online safety experience for kids?
Yeah, so just by having these 40 parents in the room with us, telling us about their experiences, that will help enlighten us to, hopefully parents around the world. So the idea of the Parent Council, 20 parents and caregivers from Europe, 20 parents and caregivers from North America, and we would love to just have lots of listen and learns with them, where we hope to get some invaluable insights on Roblox features and products. So just imagine if we could ask parents, how do you feel about the parental controls? How's that onboarding for you? How easy is it for you to use? And they give us some real life, in time advice and strategies about how it works for them. We would then love to be able to co-design something with these same parents and caregivers, with the end result being that they are educated and informed, that they realize that Roblox is a platform, that it is not a game, and that they can keep their kids safe online, and that they go out in their regions and they share that message. That would be just a win-win.
And for parents that are watching right now who may not be gamers themselves, what are some of the simple, realistic steps they could take to make sure their kids are safe online while gaming?
Yeah, for sure. I say just roll up your sleeves and get in the game. The best way to understand Roblox, and indeed any online experience, is to be there with your children, to be talking with them. An easy way to remember this is the acronym ACE, which is awareness, communication, and engagement. So for awareness, here, parents and caregivers need to understand, what Roblox is, what types of games are there, what are parental controls. Then we have communication, where it is, you having these conversations with your children, the who, what, where, when, and why, and not in the sort of interrogation mode, but where you're genuinely interested. If you show that you're interested, your children will respond. And then finally, that E is for engagement, where I would really just love it if, because you're there supporting them, they know that you are the trusted adult for them, and they will come to you with any of their risks or concerns or even successes and share that. For me, that's pretty much the thing that I would do, and the thing that I share with all the digital parents that I encounter.
Conversations about online safety can sometimes feel awkward for families. How can parents open up that dialogue in a way that builds trust and doesn't feel like they're spying or policing their kids?
Yeah, well, I think the best way is, sitting down with your child, picking a moment, picking your battles, not when they're hungry or they have homework or they're too tired, perhaps when you're just, washing dishes or going out for a walk or in the car. Just say, hey, what do you like to do online, and what are your friends doing online? And have you ever seen anything that was icky or that made you feel uncomfortable? I mean, it really is just establishing a conversation, and it is okay to let them know that you don't have all the answers, but that you're there to be their digital guardian. You're there to be support for them. And despite the fact that you are not a tech expert, the fact that you have the maturity and the expertise of being an adult, it means that you can guide them in the digital age.
And before we wrap up, where can families go to learn more about Roblox's safety features and find tools or resources to help guide their kids' online experience?
Yeah, well, there I've got more good news in that we are updating the website. Right now, you can go to roblox.com/families. You can already find guides and resources to help families and caregivers around the world. You can even find videos on parental controls, but we're making a few tweaks, so you'll see that in the next few weeks. Let me know what you think.
Thanks for joining me, Dr. Milovidov.
It's a pleasure.
Did you know someone in the U.S. is diagnosed with diabetes every 26 seconds? November is American Diabetes Month, and this year marks the 85th anniversary of the American Diabetes Association. Still working to raise awareness and to help people live healthier lives. Joining us is Dr. Rita Rastogi Kalyani, Chief Scientific and Medical Officer at the ADA. Welcome, Doctor.
Thank you so much for covering this important topic.
Diabetes seems to affect so many families. How common is it across the country?
Diabetes is a widely prevalent disease. It's affecting 38 million Americans as we speak, and another 98 million individuals in the United States have prediabetes, which means they're at risk of developing diabetes without intervention. So that's 1 in 2 Americans who is living with diabetes or is at risk. And so it is an urgent issue that will need to be addressed in the years to come. And it's important to know your risk for this widely prevalent disease.
And can you help us understand the difference between type 1, type 2, and gestational diabetes?
Type 2 diabetes accounts for the majority of diabetes. It's about 90 to 95% of all diabetes. This type of diabetes is closely linked to family history and obesity and occurs when the body can no longer respond as well to the hormone insulin. That's the only hormone in the body that lowers blood glucose. And as a result, glucose levels tend to rise. Type 1 diabetes occurs when the body mistakenly attacks itself through an immune attack, and it attacks those cells that produce insulin in the pancreas. As a result, these individuals need to be on insulin injections right away. Gestational diabetes is a kind of diabetes that occurs for the first time in women when they're pregnant. It can disappear after delivery, but even so, these women are at a much higher risk of developing type 2 diabetes in their lifetime and need close monitoring.
And what are some of the early symptoms people should watch for?
The symptoms can be quite common and it can be hard to distinguish from other conditions, but the most typical symptoms of diabetes include having blurry vision, feeling thirsty a lot, urinating a lot, unexpected weight loss or feeling tired or feeling hungry even after you've just eaten. But it's important to know that in the early stages, most people with diabetes don't have any symptoms. And so it's important to get screened and tested if you are at higher risk.
What kinds of things is the American Diabetes Association doing right now to help raise awareness and prevention?
We're doing a lot of exciting things at the American Diabetes Association. For this American Diabetes Month in November, we're really trying to heighten awareness of knowing your risk. So taking that risk task, we have a free 60-second risk task online that you can take right now at diabetes.org/risk test. And if you're found to be at higher risk, talk to your healthcare provider about the next steps.
And how is the organization working toward that goal of world-free diabetes?
At the American Diabetes Association, we're celebrating our 85th year anniversary. We are continuing our mission to prevent and cure diabetes and to improve the lives of all people with diabetes. For 85 years, we've been fighting to end diabetes by searching for a cure, advocating on behalf of all people with diabetes, and offering low cost or no cost resources to people to help them thrive. So we've been actively involved in the fight, and we encourage others to join us by finding out more at diabetes.org/ADM.
Dr. Kalyani, thank you so much for joining us today.
Thank you so much for having me.
That was our show, New Mexico Rising. You take care, and we'll see you next week.